Hi everyone, my name is Angela Rogers. I'm in Dr. Garrett's Kinesiology 552 course, and I did this critical assignment on the population of emergency room employees. The reason I chose this population is because not only have I worked next to them for 8+ years, but I was also able to connect this population to the concepts and theories that I've learned in this course. So it's definitely been super beneficial towards psychological awareness of my career and being able to implement my own thoughts while at work every day. So I think that this was quite interesting to research while doing this project. So for those of you that aren't in healthcare, I'm sure everyone knows, but emergency room employees, who are they? They are personnel that work specifically in the emergency room of a hospital. And this includes not only nurses and doctors, but also social workers, pharmacy techs, unit clerks, people that don't always directly relate to patient care. So overall, it's clinical and non-clinical staff that play a role in patient care while they're treated in the emergency room. So the psychology relating to ER employees, there's been so much research regarding cognitive barriers of emergency room employees, and most of this is based around PTSD or post-traumatic stress disorder. We'll get into that a little bit later. There are several factors that affect the performance of ER employees, and what I really hope to do after this presentation and just in general is bring awareness to the cognitive barriers of working in an emergency room. So some factors that I'm going to go over: environmental factors, objective barriers, situational factors, and a lack of support. So first, environmental factors, the overall chaos of an emergency room. The emergency room in a hospital, if you've never been in one or have never worked in one or seen one, it's a very fast-paced environment, has an abundance of tasks. You see a bunch of people running around everywhere, and some days are very slow on occasion, but as far as many patients come in there, the patient census is very, very high. So the employees that work there, they're consistently on their feet, doing things, running around. It's just a chaotic environment. So that's definitely a factor that affects performance, because you're just working so quickly that sometimes your decision making is not always optimal. Your work overload. I can't stress this enough, especially ER nurses. They go through so much burnout. Their duties that they are supposed to do, there's so much charting and patient care and documentation and drawing up medications and collaborating with physicians. There's so many job duties that include emergency room employees in general. So that can affect performance when you have so many tasks to do just for one patient, and you're getting bombarded with X amount of patients every time you're working. So that's a pretty big deal. Hospital protocols and expectations. This comes down to an administrative level. There's a lot of procedures and stuff that are involved that are statistically important for administrations and hospital organizations to stay afloat. So having the stress of having to meet those expectations in the emergency room is it's a very big factor in affecting performance. Patient to nurse ratio. Most emergency rooms that I've seen are a 4-to-1 ratio, which means 4 patients to 1 nurse. However, it does vary with severity. So some nurses might get 5 patients if one patient is, not, their acuity is the reason why they're not coming in is not so severe. So this quote right here by Landsman: work overload, the expedited process of door-to-discharge timing of patients, and lack of support from administration were key factors in initiating psychological instability. So these things are definitely factors that affect performance of emergency room employees. I'll start with education here. Patients are not educated on medical protocols. A lot of people that aren't involved in healthcare, they don't understand how procedures and policies work in hospitals. So a lot of times that creates frustration and anger, leads to communication downfalls. And then overall, because of that verbal abuse or the constant having to deal with patients that don't understand what you're trying to tell them, it leads to PTSD or just overall psychological instability, because you can't get your message through and you're constantly taking this verbal abuse. So that affects your performance as well. The socio-ecological model I read in our textbook by Ann Schell, and the definition is: several environmental factors beyond an individual's control may influence a person's ability to perform. So not having any control over certain factors. So emergency room employees, they definitely don't know what's going to happen. They go in, day out, and they have no idea what they're about to walk into. They don't know if they're going to get, 19 ambulances bombarded within an hour. They don't know if they might see one patient over the course of the whole day. You never know. So there's a lot of environmental factors that you can't control. There's things that, people slip and fall. Patients don't, they withhold information that's vital to their care and something happens later. These things you can't really control. So, and that messes cognitively with the nurse because they are consistently trying to question how they could have done better, how they could have reacted better, how they could have questioned better and assessed better, and et cetera, the list goes on. So I thought this model was very important to bring up with this population. So some solutions here, job incentives to decrease psychological instability. So maybe opening up a fitness center, your organization opening up a fitness center to help, physical activity and releasing endorphins. Outreach to communities, definitely handing out flyers, holding conferences, holding fundraisers to bring awareness to PTSD and emergency room employees. This is definitely a huge deal, especially after traumatic events in your local communities or anything that these nurses might experience outside of work as well. So these are some solutions that we can use. Objective barriers, workplace violence and conflicts. There's obviously an emergency room. You got patients coming in, that are combative and verbally abusive. And this, again, leads to miscommunications. Also, there's a lot of miscommunication that goes on between departments. Hospitals and organizations are very large. And so when you're transferring patients from the emergency room to the floors, or to different departments like radiology, CT, et cetera, there's things that sometimes are miscommunicated. And so because of that, these objective barriers are huge in affecting performance because things can always go wrong when the wrong communication or miscommunication occurs. Mindfulness is being purposely aware of your surroundings and situations. So knowing that you're aware of your situation and what's going on, being mindful of how this patient is reacting towards other people before you approach them can definitely hinder any kind of psychological harm that you're about to come across. So some quotes here. Studies indicate that improving one's well-being and undergoing a training in mindfulness decreases occupational stresses and improves the satisfaction of patients and or customer services overall. I just want to touch on PTSD for those of you that don't know what post-traumatic stress disorder is. It's a psychological stress and anxiety after witnessing a traumatic event or experience. So because emergency room employees are exposed to things that they never really thought they would see in their lives, PTSD is a very, very common occurrence. It is actually the most apparent in healthcare employees, especially emergency room personnel. So PTSD is 100% going to affect somebody's performance because they see things that they can relate to from personal experience, or, they, see children that come in, unfortunately, that sometimes don't ever make it. And that's a very tough thing as a parent to see, or, job injuries, verbal abuse, things like that. There have been various studies conducted on the severity and psychological instability caused by PTSD in ER employees. In fact, 12% of ER nurses were bullied on a regular basis by senior staff, charge RNs, or managers. So it doesn't always have to be a cause of critical events. It definitely can be a cause of colleagues. So be mindful of that. If you ever need to, God forbid, visit an emergency room, or somebody that works in one, be aware of their mindset, because a lot of times you never know what they went through that day. And so helping inhibit PTSD or the causes of PTSD is a huge solution. Proper mental health resources, seeking therapy when needed, recognition of cognitive instability by the organization itself. So seeing that administration is paying attention to the traumatic events that the ER goes through, and holding fundraisers or dinners, or recognizing the effort put in by these employees is definitely huge to make sure that their mental health is okay. Situational factors. Timing is the inability to meet demands of protocols and hospital door to discharge timing and other processes. So this goes back to the statistical administration data that is required to keep the hospital afloat. However, sometimes these expectations get really, really high and really difficult to meet by these employees. So and a solution to this is employees having a voice, having meetings with some ER employees there saying, hey, we can't meet this expectation. So I think this is a little bit unrealistic and it's really hard and puts a lot of stress on us and therefore causes us to burn out. And so again, administration altering expectations of timing protocols. So maybe making some tweaks in there to make it a little bit more realistic and manageable for ER employees. Social facilitation, I wanted to bring this up also from the textbook. It means lack of instruction or absence of others to create a more pleasant environment. So it kind of relates to people not taking leadership and more so leadership lacking. So being able to have confidence in your job and being able to facilitate critical events in an emergency room or just having the overall leadership component in an emergency room is huge. So if you don't have this, a solution is proper training. You need to have the right staff who are equipped to be leaders or anybody take that role when something big happens. Empathy and ease of expectations from administration. So kind of administration saying good job to everybody and showing support and just being there socially really helps hinder psychological instability. The last thing I want to touch on, lack of support, or organization lacking mental health resources. There is a thing called EAP that exists in hospitals, usually employee assistance program. It's usually the only one that I've seen so far, so maybe other mental health resources as well, sort of when something large like a traumatic event happens in an ER, maybe the chaplain goes around to the employees that were involved, kind of taking them aside, making sure they're okay. Inadequate staffing. A lot of people, if they're unhappy with their work environment, they leave. Or if they realize that it's causing psychological harm, they're not going to want to work there anymore. So lack of employees due to poor management, poor scheduling, and religious barriers, lack of proper churches in some hospitals. Some churches don't even have, some hospitals don't even have churches or a religious area where people can go to have prayer. So sometimes not having that kind of support when somebody is very religious and they believe that religion and spiritually helps guide them and keep their mindset intact, I believe that that's a huge lack of support when that's not available to them. So in conclusion, environmental factors are the foundation of psychological harm in emergency room employees. Situational factors are sometimes out of an individual's control but cause cognitive harm. PTSD is the most common and untreated in ER healthcare workers. Lack of support enhances mental instability, and we must increase the awareness of psychological health in emergency room and healthcare workers overall. So knowing all of these factors that come into play that affect performance of emergency room employees, we want to just bring awareness to it. Just understand that if there are people that that work in an emergency room or that have treated you in an emergency room or treated a family member, just appreciate them. Just know you don't know what they're going through mentally or personally and where their mental state is. So understanding that emergency room employees, all of them, not just nurses, not just doctors, but all of them, technicians, lab techs, pharmacy techs, unit clerks, they're all exposed to these things. So I wanted to do this project solely for that purpose. And to integrate some faith, I found this quote in the Bible from Scripture on Acts 3:16, and it says, "On the basis of faith in his name, it is the name of Jesus which has strengthened this man whom you see and know, and the faith which comes through him and has given him this perfect health in the presence of you all." So I hope you really enjoyed this presentation, and I hope that God blesses you abundantly and that you took something away from this. So the next time you visit a hospital or you have a family member in the hospital, thank a nurse, thank a doctor. Much love.